Hey YouTube, it's Nia. You know the drill. Every week I am about to thrilling controversy. Let's see what we got going on this week. Oh my gosh, it's ECT, or more commonly known as electroconvulsive therapy. For those of you who may not know, the technical definition is the induction of generalized seizure by electrical stimulants on one or both cerebral hemispheres. Why would you want to do that, would you ask? Well, it's really only used in extreme cases of psychiatric problems where traditional therapy and medicines have not offered any relief. So let's break this box open and see what we got going on. Oh, okay. So the first thing we have is a warning label. Let's see what this is about. Warning, this topic is highly controversial and many may have strong or triggering symptoms as a result of this product. Remember, if you're watching this video because you're trying to see if ECT is right for you, you may be triggered by any of the content talked about in this video. We want to remind you that you can always call the National Suicide Prevention Hotline right here. Let's get into this box. Okay, the first thing we have is a history of unethical beginnings. The history and the beginning of this controversy back in the 60s and 70s, a little sketchy. The lack of trust in the system was because it was used as social control. So you're acting up, looks like you're getting shocked. Now, that's not how it is today, but those misconceptions still happen. Let's look at what the next item this controversy has. Looks like a blurry line of consent. Some people felt that even after signing a form saying that they did consent, still weren't exactly sure that they knew enough about the procedure to feel completely comfortable with it. It makes it really hard for ECT to be taken seriously. All right, let's see what else we got going on in here. Negative media representation. This comes with some examples. Roll the clip.
Okay, this won't hurt and it'll be over in just a moment.
Uh-huh. What's that?
Conductant.
A little dab will do you. That right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it. That's right. Just bite down.
huh?
The after effects are minimal. You'll feel a bit like you have a hangover.
Mommy, don't let them do this. It causes brain damage.
Your mother's in for a new treatment, ECT.
Okay, LMNOP, what is that? I don't know.
Electroconvulsive therapy, shock therapy.
A minority of patients report some memory loss, but it's usually not much memory.
How do you know how much memory you've lost if you've lost it?
You're kidding, right?
As you can see, those are very harsh representations of ECT and the people who are forced to undergo them. If somebody undergoing ECT has been using this for years and it's a well-established system for them, and then a politician, just from these negative media representations, feel as though it's not safe, they might take that away or put legislation in making it harder for the people who need it to use it. That is really not okay. Alright, let's take a look at what this next one is. Oh my gosh, it's a big one. It looks like huge misconceptions. For example, a lot of the times, people think of the controversy as something like this. Barbaric, torture, somebody being held down against their will, shocked until they can't move, when in reality, it really looks more something like this. No holding down, for the most part, free consent, and a team of doctors, nurses who are very educated on this procedure, and the person's under anesthesia, so they don't even feel it. Even more so, now nurses who are going to be helping in the ECT room have to go through strict training, all to make sure the person feels safe. Another big misconception is that people will probably die from ECT. Let's check the facts. Research that came out in 2017, that the death rate for people who have gone under ECT is 0.08%, which is comparable to the death rate for general anesthesia. Wait, what does that mean? You have the same chance of dying from ECT as you do any surgery that you have to go under general anesthesia. Meaning you could go under to get your tonsils taken out with the same chance of dying as ECT. See, that's not that scary. Severe memory loss is a big issue with ECT. However, the information on that is also misconstrued. Research has shown that many return to their baseline memory and cognition tests as little as 2 days and as long as 10 days. There are a few outliers to this, and people report that they have taken years to get their memory back. They are the outliers. For example, remember that math class that you took in college that you absolutely hated, and the teacher was so gracious to curve your grade? Well, let's say there's a bunch of kids in the class, and this chart basically looks like it. So the average was like about 70%, and then you have that one person who gets that 105. They're sitting all the way over here. They are not the norm. Everybody else is like this, they are like this. That's essentially what we're talking about here. Everybody else gets their memory back between 2 and 10 days, and then there's that one person who gets 2 years. See what I'm saying? Let's see what else we got in here. Efficacy of treatment. What is efficacy? That's basically the ability for the treatment to work. In a double-blind study, that means that the researchers and the participants had no idea what they were testing, so there would be no bias that could get in there. Well, they demonstrated that ECT was effective in reducing suicidal thoughts and depressive episodes for patients with major depressive disorder. Some studies even show that it can be used only just a few times and make more traditional treatments useful again. So basically, after you go through those slight seizures, your brain is a little wired differently, and then the medication or psychotherapy will actually work for you. Awesome. Let's pull out our final item. So what we got is a big question mark. Why is this still a controversy? Besides what we already talked about, one of the biggest issues advocates against ECT have is that the precise mechanism of how and why it works is still unknown. Research does not show exactly what is going on that makes it effective. Finding the perfect treatment for people suffering with severe mood disorders isn't like a light switch. No pun intended. Another big issue with this controversy is people don't really know that it exists. Obviously, this happened in the 60s and 70s, and that's all that people think that we do anymore. People think that ECT isn't even a thing. So when they talk about it, the first thing they think of is get rid of it, which is why I made this video, so you won't be one of those people. Well, looks like another one for the books. Oh no, this one comes with added subscriptions. The real final thing we have here is new research. Like I said before, this controversy seems way outdated, but there's actually a bunch of research that came out in 2017 demonstrating that this controversy is far from over. ECT is only really used in extreme cases. More research is coming out showing how it can help people suffering from PTSD. A new study with mice showed insight into the mechanisms underlying the side effects of ECT. And doctors have begun looking into what to do before treatment to reduce the risk of those side effects. With more research, we will be able to figure out what's causing those negative side effects and potentially reduce them or get rid of them altogether. Looks like this one's all boxed up. Hope you liked this video, and if you did, please subscribe to my channel right here. And if you liked what you saw and want to learn more about other controversies, check out my other videos here and here.